visual inspection. I'm doing hand hygiene. Okay, so I'm going to start with the visual inspection of your abdomen. Gonna read your shirt. The abdomen is smooth with no scarring, striae, rashes, lesions, bruises, or any discoloration. There's no visible pulsations, peristalsis, masses, or herniations. The abdominal contour is flat. Next, I'm gonna also take all 4 quadrants, starting with the right upper quadrant. Tinkling and bowel sounds are present in all 4 quadrants. Peristalsis is normal. And now I am going to listen to the arteries. I'm going to also take with this diaphragm. The aortic artery is above the umbilicus. And then I'm going to move on to the left renal artery. And then to the right, that's above the belly button. And then the left and right iliac arteries, which are below the belly button. And I would listen to the femoral arteries. There's no bruits, and there's no bruits. Okay, so now I'm gonna percuss. In all 4 quadrants, of course. So I can hear the tympanic sounds in the stomach area because there's gas there, and then there's dullness. There's dullness sounds in the lateral areas. Now I'm gonna palpate. Can you please hold your shirt for me? And let me know if you have any tenderness. I'm gonna move my fingers in gentle circles.
No tenderness.
In all 4 quadrants. No tenderness or guarding, firmness, or superficial masses noted. Now I'm gonna push a little deeper, okay? No organomegaly or inflamed colon or deep masses noted. Okay, now I'm gonna have you lay down. I'm gonna try to palpate the liver edge. I'm gonna hook my fingers at the costal margin. Take a deep breath in and slowly let it out. The liver edges are not palpable, and the liver edges do not descend below the liver margin or the CVA margin. Now I'm going to try to palpate the spleen. I'm going to go to the opposite side. Placing my left hand underneath that costovertebral angle and my right hand on the abdomen at the left costal margin. Take a deep breath. I'm pushing the spleen up and down. And I don't feel it, so your spleen is not enlarged. Good job. Not enlarged. Now I'm going to test for rebound tenderness, okay? So if you're telling me that you're having pain on the right side, I'm going to test on the left side because we test rebound tenderness on the opposite side. Okay? Okay, I'm going to press into the right lower quadrant and quickly release. Did you feel any pain? Pain is not worse after feeling pressure, so there's no signs of peritonitis. And also no inflammation, so rebound tenderness is negative. So now I'm going to do a test for appendicitis which is at McBurney's point. So I'm gonna move to the right, and it's between the ASIS to the umbilicus. So that's about right there. So I'm gonna press down. Any pain? No focal tenderness or guarding, so negative McBurney's point. So now I'm gonna check for acute cholecystitis. So my left hand's gonna go under your right abdomen. And then my right hand's gonna go below the right costal margin at the midclavicular line. Take a deep breath for me. And I'm gonna press gently down, upward. Patient did not stop inhaling, so there's no pain present. So negative Murphy sign. No acute cholecystitis. Okay, I think we're done with that. Okay, stay laying down. I'm gonna palpate the aorta above the umbilicus on both sides. It's about 4 centimeters. It's pulsatile, normal size. Wow. Okay, please sit up for me. I'm gonna check for cossovertebral angle tenderness. I'm gonna stand on this side. Can you turn for me a little? Okay, base of the ribs at the spine. And then I'm gonna apply some pressure to that. Then I'm gonna do it on the other side. No pain or tenderness, right?
No pain or tenderness.
So no sign of infection. Okay, good. Now we're gonna move on to the upper extremity. So now I'm gonna test your range of motion, okay? So put your chin in your chest. Flexion is intact. Face to the sky. Extension is intact. Turn your head to the right. Turn it to the left. Rotation is intact. Both sides bilaterally. One ear to the shoulder. Do the opposite side. Lateral bend is intact. Cervical spine, range of motion is intact. Okay, now we're gonna test cranial nerve 11, which is the accessory cranial nerve. Now I'm gonna have my hand on your face, try to turn towards it against resistance. Okay, other side. Okay. Now I'm gonna put my hands on your shoulders and try to shrug against resistance. One more time. Patient was able to do that. I move against resistance. So cranial nerve 11, accessory is intact. Awesome. Now I'm going to test light sensation. Close your eyes. Tell me where you feel my finger, okay? Actually, I'm gonna need you to. Okay.
Hand.
Did you feel that?
Yes.
Okay. You need to hold your arms up for me. Just relax them. So just relax your arms in your lap, get comfortable. I'm going to be tapping you with this, okay? So for the biceps, I'm gonna place my fingers over the biceps, which is, okay, I'm gonna tap on both sides. Biceps reflex is intact. Now I'm gonna do the triceps. I'm gonna lift and support your arm. Now I'm gonna, okay. Brachioradialis, reflex is intact. biceps, triceps, and brachioradialis reflexes are intact. And 2+ bilaterally. Okay? So now we're gonna move forward and I'm going to have you stand up. Now I'm gonna test your shoulder range of motion, okay? So if you have any questions about the movements, tell me. Raise your arms straight and forward and overhead. Flexion is intact, 180 degrees. You put your arms down. Move your arms straight back, like Superman. Extension, 50 to 60 degrees is intact. And then raise your arms out sideways and overhead. Abduction is intact, 180 degrees. And then raise your right arm across your body. And then opposite arm. Adduction is intact. It's like 30 to 50 degrees. And then raise one arm behind your back and touch the opposite scapula. And then repeat. Internal rotation is intact. Then raise your forearms to 90 degrees. Elbows flex. And then rotate your arms outwards. External rotation is intact. And all shoulder range of motion is intact. That is phenomenal. Now I'm going to test your elbow range of motion. Okay. Bend your elbow. Flexion's intact. Straighten your elbow down. Extension is intact. And then rotate your forearms so your palms face up. Supination is intact. And then rotate them down. Pronation is intact. All elbow range of motion is intact. Great job. Now we're going to test wrist range of motion. You don't have to do that. Bend your wrist so the palm moves down. Flexion is intact. Now lift your hand upwards. Like you're saying stop. Extension is intact. Good job. Move both hands towards the thumb side. Radial deviation is intact. And then move both hands towards the pinky side. Ulnar deviation is intact. All wrist range of motion is intact. Now we're going to test hand and finger range of motion. So make a fist. Finger flexion is intact. Straighten them out. Finger extension intact. Spread your fingers apart. Abduction is intact. Bring them back together. Adduction intact. Touch your thumb to each fingertip. Thumb opposition is intact. Move your thumb across your palm and away from the palm. Thumb flexion is intact. All hand and finger range of motion is intact. Okay. You can go ahead and sit back down. Now I'm going to test your upper extremity strength. Bend your elbows and lift them up to the side. Up to the side. Push your shoulders up against my hands. Shoulders are strong and equal resistance and deltoid strength is intact. Now relax, bend your elbow again. Pull back against my hands. Pull towards yourself. Good. Okay. Pull towards yourself one more time. Now push against my hands. Oh, same way. Push, like push your wrist, push your forearm against me. Good. Elbow flexion and extension are strong and equal against resistance. Biceps and triceps strength are good. Intact, equal bilaterally. Okay, hold both hands up like a stop sign. Bend your wrist down towards me. And then place, I'm gonna put my palms. Okay, bend your wrist against my hand. And see if you can resist that. Do you feel good resistance? Keep pushing. Okay, awesome. Wrist flexion and extension is strong and equal bilaterally. Your wrist flexors and extensors are strong bilaterally. Okay, next squeeze my hands. Hand strength is strong and equal. Flexor, digitorum, and intrinsic muscles are intact. Now hold your hands out, palms down. Spread your fingers apart. Don't let me push them together. Resist me, okay? Okay. Finger abduction is strong and equal against resistance bilaterally. Hand strength is intact. Okay, touch your thumb to your pinky on both hands. Don't let me pull them apart. I'm gonna try my hardest. Thumb opposition is strong and equal thumb muscles are intact. Okay, we're gonna switch gears to the lower extremity, okay? You have on some thick socks. We're gonna test light sensation. Close your eyes. Tell me where you feel my hands. Okay. Do you feel it? Do you feel it?
Mm-hmm.
Okay, scoot back a little bit for me. I need your legs to hang. I need your legs to hang, honey. Scoot back up. Let them, they need to hang. Scoot up a little bit. Okay. Patellar reflex intact 2+ bilaterally. I'm tapping with the hammer side. Now I'm going to tap the Achilles tendon. Achilles tendon reflex intact 2+ bilaterally. Now I'm going to use this and I'm going to lightly trace the bottom of the foot to the ball of the foot. Negative Babinski reflex, the toes didn't fan out.
Oh, man.
Are you okay?
Yeah, I just tickled.
Okay, close your eyes and tell me if I have your big toe pointing up or down.
Up. Up.
Okay, proprioception is intact. Now that we've done that, I'm going to have you stand again. I'm going to test your hip range of motion. Bring your knee towards your chest. Other knee. Flexion is intact. Move your legs straight out behind you like this. Extension is intact. Move your right leg to the side or your left leg. Abduction is intact. Move your right leg across your body to the left. And the opposite. Adduction is intact. Flex your right hip to 90 degrees and rotate your foot out. Repeat on the other side. External rotation intact. Flex your right hip to 90 degrees again. Rotate your foot in. Internal rotation is intact. Do it on your other leg. All hip range of motion is intact. Good job. Sorry, balance is a little bit off. Now I'm going to test your knee range of motion. Okay, you got your balance? Okay. Bend your right knee. Now bend your left. Flexion's good. Straighten out your knee on the right, and then on the left. Extension is good. Sit down again. I'm going to test your ankle and foot range of motion. Point your toes up on both feet. Point your toe. Extension and flexion are good. Turn the bottom of your feet in, and then the bottom of your feet out. The bottom of your feet out. Eversion is good. Now I'm going to test your lower extremity strength. Okay. I'm going to place my leg behind your lower leg. Pull towards yourself, okay? Against my hand. Pull towards yourself. Now straighten your leg out against. Good. I'm going to do on the opposite leg. Push in, towards, resist. Now push out, resist. Knee flexion and extension are strong against resistance, and hamstrings and quadriceps are intact. Now, I'm going to need your toes. I'm going to place my hands on top of your feet, point up and press against them. Now press against them like a gas pedal. Good. Okay. Good job. Okay, so plantar flexion and dorsiflexion are good against resistance. Tibialis anterior, gastrocnemius, and the soleus are intact. And then I'm gonna have you do this one more thing. Can you turn your feet in against my hands and then out against my hands? Okay. We're gonna stand up again, turn around, bend over slightly so I can inspect your posture. I'm gonna visually inspect the spine from cervical to lumbar. No pain or tenderness, no scoliosis, kyphosis, or lordosis. Now I'm gonna test your pelvis range of motion, okay? Bend forward and bend backwards. Bend backwards. Okay. Anterior and posterior tilt range of motions intact. Rotate your chest to the right and then to the left. I'm gonna hold your hips to prevent you from rotating your hips. Good job. Rotation is intact. And then turn side to side. Up, lateral, baby. There we go. Lateral bend intact. Okay, now we're gonna test your coordination, your balance, and your gait. You can face towards me. Touch your thighs with your palms, then the back of your hands, and see if you can do that back and forth. As fast as you can, as smoothly as you can. Okay? Rapid alternating movements are smooth, coordinated, and performed at a good pace. Now I'm gonna hold my finger in front of you, touch my finger, and then touch your nose. Touch my finger, touch your nose. Back and forth. Now I'm gonna move it around each time. Now the other side. Finger movements are smooth, accurate, and coordinated by right leg. And move it down the shin of your left leg. Now repeat on the other side. Heel to shin movement is smooth, controlled, and accurate bilaterally. Coordination and cerebellar function are intact. Okay, now I'm going to have you, I'm going to test your cranial nerve 8, the vestibulocochlear, specifically the vestibular portion. Place your feet together. Arms relaxed at your side. Now close your eyes and stand for 30 seconds. Okay, open your eyes. Okay, this will be done for 30 seconds each. 30 seconds, eyes closed, and 30 seconds, eyes open. Okay, and there's no swaying or instability. Negative Romberg test. Cranial nerve 8 is intact. Okay, now I'm going to have you hold out your arms with your palms facing up and close your eyes. Arms remain steady without pronation or drift, pronate or drift negative. All right, now you open your eyes, walk in a straight line, toe to foot, place the heel of one foot in front of the other one. Tandem walking is smooth, coordinated, and balanced. Okay, you can stop. Now stand on your tippy toes and walk forward. Now turn around and walk on your heels. Okay, turn towards me and do a shallow knee bend, like almost a squat, but not quite. A shallow knee bend. Coordination and balance is intact. You may take a seat. You did great. Do you have any questions for me?
Nope.
Okay. Hand hygiene, I'm gonna exhale.